Hello everyone, welcome to the another lecture of clinical toxicology of Pharm fourth year. So today we are going to see another important concept of toxicokinetics. Again, this particular topic is very important from exam point of view, especially for the long essays and long answers. So let's see the concept of toxicokinetics, right? So if we will break this term toxicokinetic, we can get toxic, right? So what is the toxic and the kinetics, right? So we might have studied the pharmacokinetic in the pharmacology. So with parallel of that, this is a concept of toxicokinetics. So let's see the definition, right? It is a study of time course. What we are studying here, we are studying the time course of ADME parameter, that is absorption, distribution, metabolism and elimination of toxic substances, right? In pharmacokinetic, we were seeing the ADME course of pharmacological substances. However, in the toxicokinetics, we are going to study the ADME profile of toxic substances in the body. कहाँ पे? In the body with relations to the toxins, the dose and the concentration of toxic substances in our body, fluid and tissue. राइट कौन सा टॉक्सिक सब्सटेंस कितने रेट में ऑब्जॉर्ब हो रहा है, कहां कहां पे डिस्ट्रीब्यूट हो रहा है, कैसे वो मेटाबोलाइज हो रहा है और कहां से एक्सक्रेट हो रहा है, हम उसकी जो डिटेल स्टडी करते हैं उसको हम क्या बोलते हैं, टॉक्सिकोकाइनेटिक्स. सो बेसिकली what our body does to the poison, what our body does to the poison, as what our body does to the drug is known as pharmacokinetics. In the simple way, what our body does to the poison is known as the toxicokinetics. Now, why it is important to understand the concept of toxicokinetic, that is known as significance of toxicokinetics. Now here, let's see some significance of toxicokinetics. Initially, predict the onset and severity of duration. राइट इसका ऑनसेट कैसा होगा, इट गिव्स अस आइडिया, विच गिव्स अस आइडिया, द अब्जॉर्प्शन कोर्स गिव्स अस आइडिया कि हाउ द symptoms will get onset and what will be the severity of poison, right? Some poison substances are there which are readily absorbed, they will be having obviously higher severity based on their usual fatal dose. And what should be the duration, the poison substances will stay in our body. That idea we will get from the concept of toxicokinetic. Similarly, it will help us in assessing the need of emesis, right? If there are some substances which are very poorly absorbed or they will stay for a longer time in our stomach, then we can go for induction of emesis or with the gastric lavage process. Or if that poison substances are there in the stomach, then we can go with the activated charcoal, right? Now, you just imagine if some substance is there which is readily getting absorbed within few minutes or within an hour from our GI system, then inducing emesis or doing gastric lavage or administrating of activated charcoal does not make much benefit to the patient. So we need to see that that will be assessed by the study of toxicokinetic of that particular substance. And it is also useful to determine the dose, time and need of antidote also, right? If we know the ADME profile of that particular poison substance, then only we will get idea ki how we have to caliber the antidote in that particular poisoning. Similarly, it will help us to understand whether there are the use of elimination techniques or not. If we are knowing that some substances are there, we are readily bind to plasma proteins or they are readily bind to the tissues, then if we are using the extracorporeal techniques also, these drugs are not freely available, then they will not be removed from the extracorporeal techniques. And if some drugs are there which are largely available in the blood in the free state, those will be readily removed by the application of extracorporeal techniques. So that also idea will be coming, we will get by the study of toxicokinetics. Similarly, diagnose and interpret the toxicological and laboratory values, right? This also idea will be given by the study of toxicokinetic. Then one another, we all know that it is having the forensic significance also, right? Now with this background, slowly we will see what are the components of toxicokinetics. As we have discussed, there are four basic parameters, four basic course of toxicokinetic. First is the absorption. So how this absorption is crucial for us, right? Now this absorption means how this toxins or the poison substances getting absorbed in our systemic circulation. What is the route of absorption, whether it is absorbing through the oral route or it is exposed through inhalation or dermal exposure or eye exposure or sometime parenteral exposure. that is studied in the absorption factor. Now what are the factors affecting that absorption, like solubility? If it is readily soluble, the absorbability will be high. What are the formulation, solid dose or liquid dose? Liquid dose are generally readily absorbed. Then what is the gastric emptying time? If the gastric emptying time is very fast, we will go with the catharsis process or whole bowel irrigation process. If gastric emptying time is so late, then we will go with the induction of emesis or gastric lavage, or by giving the activated charcoal. Then what is the relation with the pH and all those factors will determine which type of technique we can use in the management of poison substances. Then another, it also helps us to estimate the use of decontamination technique, right? As I have mentioned, lavage, emesis, or we should go with the extracorporeal technique, or we should go with the catharsis or whole bowel irrigation. That idea we will get after knowing the absorption profile of that particular drug. Now similarly, our another course is the distribution course. So what is the distribution? As we have studied in the pharmacology, right? The reversible transfer of toxins from blood to the tissue, right? पहले distribution के time पे क्या होता है? This toxin substance will go and readily bind to the tissue, and after some time, slowly, when the concentration of these poison substances is getting low in the blood circulation, then this substance will be released slowly from the tissue. And if it is highly bound to tissue, then extracorporeal techniques are not useful. So that also we need to keep it in our mind. Now some factors which are affecting the distributions are protein binding, tissue binding, then the lipophilicity of the drug and its ability to cross the blood-brain barrier. So all these things will affect the distribution pattern. Now we will see some example. These lipophilic substances like organochlorines accumulate in the adipose tissue, so that extracorporeal techniques are not much of use, right? Then lead stores in the bone. Now if there is a lead toxicity also, now there is no use of any decontamination procedure or any extracorporeal techniques, right? Now what is the key take in the distribution is large volume of distribution is indicating that there is a poor removal of drug by the extracorporeal technique, because these drugs are not freely available to get exchanged during the hemodialysis, peritoneal dialysis or other techniques, right? Now, and this drug, once it will go to the tissue and the plasma proteins, slowly they will be redistributed in our body, which will have the prolonged toxicity type of symptoms, right? So again, this is a important key why volume of distribution is so crucial for us. Now we will see the another parameter, that is the metabolism parameter. What is this metabolism? The metabolism is similar to the pharmacokinetic related metabolism only. This is the course of enzymatic conversion of toxins into the less, more or toxic substances, right? Some poison substances after metabolism, they will become less toxic, and some will even become more toxic, right? So generally majority of metabolism, like drugs, it will occur in the liver only, majority in the liver. That's why here is a star mark. Then sometimes this may get metabolized in kidney, lungs and intestine also. So again here the same reactions will be like that in the pharmacokinetics. Like in phase 1, they will undergo oxidation or reduction or hydrolysis by the help of cytochrome P450 enzyme or some other enzyme system. Now in the phase 2 type of metabolism, there will be the conjugation reaction like glucuronoid conjugation, sulfation or acetylation, which will add some additional functional group to make them water soluble, so that they will get eliminated from our body system, right? So now this conversion will lead to the conversion of these drugs into the more water soluble substances, so that they will get eliminated from our body. Now we will see one example in the metabolism. Now you see, if paracetamol is metabolized, its derivative is NAPQI, which is actually toxic. Similarly, if we will see the methanol poisoning, this is spelling mistake is there, this is not methyl, this is methanol, right? If there is a methanol poisoning, in the influence of alcohol dehydrogenase enzyme, this methanol will convert into the formic acid. Now this formic acid is more toxic than the methanol. Actually this methanol is non-toxic, its derivative is toxic. Similarly, paracetamol itself is not toxic, however its metabolite is toxic. So it will lead to the toxicity symptoms. So this idea we will get from the study of metabolism. Now very important concept, enzyme inhibition or induction will lead to the alteration of toxicity course, right? Now majority of toxin affects the liver during the metabolism, because this liver is the main site of metabolism. तो जहाँ पे metabolism होगा वहाँ पे injury तो होगी ही, राइट। जैसे जहां पे वार होगा वहां पे नुकसान होगा, तो ऐसे ही यहाँ पे भी मेटाबॉलिज्म का सीन है। नाउ द अनदर इंपॉर्टेंट कॉन्सेप्ट इज द एक्सक्रेशन. नाउ दिस इज द fourth parameter in the course of toxicokinetic. So this, what is the concept of excretion? Means removal of toxin substances or these metabolites of these toxin substances from our body. So now in the excretion, renal route is the major route. Sometimes they may be excreted from the biliary route, pulmonary route, or sweat gland also. So renal function, glomerular filtration rate, pH of our urine, then binding of these drugs with the proteins, and the molecular size of this protein. All these are the factors which will affect the elimination process. Now there is one concept we have to understand it very carefully. If there is a alkaline urine, what it will do means it will enhance the acidic excretion, and if the urine is acidic, it will enhance the excretion of alkaline compound. So this important concept we need to keep it in our mind, so that when we are going with the post diuresis process, if we know the nature of poisoning, whether it is acidic or basic, in that way we can use the acidifier or alkalizer while inducing the diuresis process. Then for here example is like alkalization is required. We are administering sodium bicarbonate in the salicylate poisoning, because this salicylate poisoning actually hamper our body by inducing a lot of lactic acid. This lactic acid will make our body acidic, and these compounds, if we are alkalizing our urine, these compounds will be easily excreted from our body. Now another important things we have to consider here means some special populations have the altered toxicokinetics, and some population which comes under special population are especially children, elderly, geriatric people aged more than 60 or 65, then pregnant ladies, and lactating mothers, or some organ failure persons like heart failure, liver failure, renal failure and all. And if the person are having some genetic issues or genetic polymorphism, so those populations are considered under the special population. So we need to see if this toxicokinetic, course of toxicokinetic is altered in them, right? So in summary, what we want to understand means this toxicokinetic help us in determining the need of decontamination. So it also helps us to assess where there is a need of extracorporeal techniques like dialysis or not, and it will also guide us in the requirement of antidotes and dosing of antidote also, and how we can enhance the elimination, right? If we are able to optimizing all these parameters, it is very easy for us to manage the toxicological conditions, right? Now before completing this particular topic, we will see another important graph here. So this graph we might have studied in pharmacology, pharmaceutics, biopharmaceutics and some other subjects. So there we used to draw the graph in the plasma concentration of drug versus time. This is very famous graph for the pharmacy people. Now here, instead of drug, there will be toxins, right? So this is the absorption phase of toxins, where due to the absorption and the concentration will keep on increasing over the period of time, and it will reach the peak concentration, that is called Cmax. Now this window, after in pharmacology we shows that we have seen that this is a minimum concentration, right, where we will get the pharmacological effect. But in this case, this is the minimum concentration where we will get the toxicological effect. That's why this is known as maximum safe concentration. After this, there is a toxicity, right? Once Cmax is achieved, slowly elimination will be increased and absorption will be decreased. In this way, this resembles the elimination phase, where elimination is high and absorption and metabolism is less. Now this particular graph is the plasma concentration of toxins versus time ka plot. So if there are some questions related to the toxicokinetics, this particular graph we need to draw in our answer sheet, and we need to explain all these parameters, what is the meaning of these parameters and how they are determining or denoting the course of toxicokinetics, right? So now what is the final take from the today's class, that is toxicokinetics. The concentration time curve represents the toxicokinetics, showing absorption, peak plasma concentration and elimination of toxins, right? So this is a particular graph. Now again I will just have a recall why we are discussing this much about toxicokinetics, because it helps us in determining the need of decontamination, predict the use of extracorporeal techniques like dialysis, and they will largely guide us in the administration of antidotes and whether the elimination can be improved or not, so that we will able to decontaminate our body or reduce the concentration of these poison substances in our body, so that the survivability of the poison intoxicated substances will be high. So that is all about the toxicokinetic. So let's meet with the another toxicological conditions along with the case study in the another class. So thank you for patiently listening today's class. So please like the video, subscribe the channel and share this content with your colleagues and friends, so that they will also get benefited from the class. Thank you for being patient and listening today's class. Thank you.